She thought she was just tired. Margaret was 58 years old, active, relatively healthy, no major diagnoses. She noticed she was waking up twice a night to use the bathroom. She assumed it was her age, catching up with her. She noticed her ankles looked a little swollen some mornings. She told herself she had been on her feet too long, and when she started feeling a dull, persistent ache in her lower back, she blamed the garden work she had done the weekend before. For almost a year, Margaret's body had been sending her urgent messages, and she had been answering every single one of them with a perfectly reasonable excuse. By the time she finally saw a doctor, not because of those symptoms, but because of an unrelated checkup, her kidney function had dropped to 32%. She was in stage 3 chronic kidney disease. And she had no idea. This was not bad luck. This was not random. This is exactly what kidney disease does. It moves quietly. It mimics exhaustion. It looks like aging. And by the time most people realize something is genuinely wrong, significant and often irreversible damage has already been done. I have spent years working with patients who were told their kidneys were in serious trouble, and almost every one of them looked back and said the same thing. I had the signs. I just didn't know what I was looking at. That is why this video exists. Today I'm going to walk you through 5 of the most commonly missed warning signs that your kidneys may be under serious stress or beginning to fail. I will explain what each sign means, why so many people dismiss it, what is actually happening inside your body, and what you can do right now. Stay with me, because the third sign on this list is the one that surprises people most. Before we get into the signs, I want you to understand why the kidneys are so uniquely dangerous when it comes to silent disease. Most people think of their kidneys as filters, and that is essentially correct. Every single minute, your kidneys filter approximately 1.3 liters of blood. Over the course of a day, they process nearly 200 liters, cleaning out waste, regulating fluid, controlling blood pressure, managing your mineral levels, and producing hormones that your body depends on. They are doing all of this constantly, automatically, and silently. Here is what makes kidney disease so deceptive. The kidneys have enormous functional reserve. Think of them like a highway with 12 lanes. You can close 2 lanes, 3 lanes, even 5 lanes, and traffic still moves. It slows down, it adjusts, but it moves. The kidneys can lose more than half their function before the body produces obvious, undeniable symptoms. By the time you feel genuinely ill, the damage is often already advanced. According to the National Kidney Foundation, approximately 37 million adults in the United States alone are living with chronic kidney disease. And of those, nearly 90% do not know they have it. In the UK, Kidney Research UK estimates that 1 in 10 adults has some degree of reduced kidney function. The numbers are staggering, and the silence is exactly what makes this so dangerous. After the age of 50, kidney function naturally begins to decline at a slow rate. But when that natural decline is accelerated by high blood pressure, diabetes, over-the-counter pain medication use, dehydration, or other factors, the drop can be significant and fast. The challenge is that the early warning signs are not dramatic. They are quiet. They are easy to explain away. And that is precisely why I want to walk through them carefully with you today. The first warning sign is one that most people notice but never report to a doctor. Changes in how you urinate. Now, when I say changes, I want to be specific because this is where people get confused. Most adults assume that frequent urination is simply a sign of drinking more water, or, for men, a sign of prostate issues. And sometimes that is exactly what it is. But when the kidneys are under stress, the pattern of urination changes in ways that are distinct and worth paying attention to. You may find yourself waking up multiple times overnight to urinate, a condition called nocturia. You may notice that your urine appears unusually foamy or bubbly when it hits the water, You may find that despite urinating frequently, you produce very little actual volume. Or conversely, you may notice a significant decrease in how often you urinate, which can be an even more alarming sign. Here is what is happening biologically. Healthy kidneys regulate the concentration of urine based on your body's needs. When they are damaged, that regulation breaks down. Foamy urine, in particular, is a significant signal. It indicates the presence of protein in the urine, specifically albumin, which healthy kidneys are designed to keep inside the bloodstream. When the filtration system is compromised, protein leaks through. That foam is not nothing. That is your kidneys telling you they are struggling to hold the line. A study published in the American Journal of Kidney Diseases found that proteinuria, protein in the urine, is one of the earliest and most reliable biomarkers of kidney damage, often appearing years before any clinical symptoms develop. Most people see foamy urine once and think nothing of it, but if it is happening consistently, even 2 or 3 times a week, that is worth a conversation with your doctor. Ask for a simple urine test called a urinalysis, or more specifically, a urine albumin to creatinine ratio. It is a straightforward test and it can catch kidney stress very early. We are only at the first sign, and already we are looking at information that most people have never been told. Let me show you what the second sign looks like. The second warning sign is swelling, specifically in the lower extremities. The ankles, the feet, sometimes the legs. Swelling sounds serious. And it is, but here is why people consistently dismiss it. Almost everything causes swelling. Standing for a long time causes swelling. Flying causes swelling. Hot weather causes swelling. Eating a salty meal causes swelling. And so when someone over 50 notices that their ankles look puffy after a long day, the last thing that comes to mind is kidney disease. But there is a difference, and once you know what to look for, it becomes clearer. Kidney-related swelling tends to appear most noticeably in the morning after you have been lying flat overnight. It often affects both legs equally. It may be accompanied by a feeling of heaviness or tightness in the legs, and critically, it tends to persist. It does not fully resolve after a night of rest. It comes back consistently, gradually getting worse over weeks and months. Here is the physiological explanation. The kidneys are responsible for regulating sodium and fluid balance in the body. When kidney function is impaired, the kidneys begin to retain sodium instead of excreting it. Sodium pulls water with it. That water accumulates in the soft tissues of the body, particularly in areas affected by gravity. The legs, the ankles, the feet. This is called peripheral edema. And in the context of kidney dysfunction, it is a sign that the body's fluid regulation system is failing. Additionally, and this connects back to what I said about protein in the urine, when the kidneys leak albumin, blood protein levels drop. Albumin plays a critical role in keeping fluid inside blood vessels. When albumin drops, fluid escapes into surrounding tissue. More swelling, more discomfort, more easy to explain away symptoms. The kidney disease, improving global outcomes guidelines specifically list unexplained peripheral edema as a clinical flag that warrants kidney function testing. If your legs or ankles are consistently swollen, especially in the morning, especially in both legs, please ask your doctor to check your kidney function. Do not wait. It is a simple blood test. We are talking about a creatinine level and an estimated glomerular filtration rate, or eGFR. Those numbers will tell you a great deal. Now, we are halfway to the sign that I think will genuinely surprise you. But first, I want to share the one that people most consistently mistake for a completely unrelated problem. The third sign, and the one that catches almost everyone off guard, is persistent fatigue and what many people describe as brain fog. I want to spend a moment here because this is where things become genuinely serious. And it is also the sign that is most consistently attributed to everything except the kidneys. When a patient over 50 complains of deep, unrelenting tiredness, the kind that does not improve significantly with rest, They are typically assessed for thyroid issues, anemia, depression, sleep apnea, vitamin deficiency. All of those are valid and important things to check, but the kidneys are almost never the first thing a non-specialist thinks to investigate. And that is a problem, because kidney-related fatigue is both real and severe. Here is the mechanism. When the kidneys are failing, they produce less of a hormone called erythropoietin, EPO. Erythropoietin signals the bone marrow to produce red blood cells. When EPO drops, red blood cell production falls. When red blood cells fall, the blood carries less oxygen to every organ in the body, including the brain. The result is a profound cellular-level exhaustion that no amount of sleep fully resolves. This form of anemia is not caused by iron deficiency or diet. It is caused by kidney dysfunction. And treating it with iron supplements will do very little. At the same time, when the kidneys cannot adequately clear waste products from the blood, those toxins begin to accumulate. Urea, creatinine, and other metabolic byproducts begin to circulate at elevated levels. This toxic accumulation, called uremia in its advanced form, affects brain function directly. Concentration becomes difficult, memory feels foggy, decision-making feels slow. Many patients describe it as thinking through wet concrete. The National Institute of Diabetes and Digestive and Kidney Diseases reports that fatigue and cognitive impairment are among the most frequently reported and most frequently under-recognized symptoms of chronic kidney disease in adults over 50. This is one I want you to sit with for a moment. If you have been struggling with a level of tiredness that does not make sense, that feels disproportionate to your activity level, your sleep, your stress, please do not accept it's just aging. As a complete answer, ask for a full kidney function panel. It may not be the kidneys, but it is absolutely worth ruling out. Pause here and tell me in the comments, has anyone close to you been dismissed with fatigue that turned out to be something more serious? I ask because these are the stories that need to be shared. The fourth sign moves us somewhere that most people would never connect to the kidneys: the skin. Persistent dry skin, unexplained itching, particularly at night, and in some cases a grayish or yellowish tinge to the skin. These are real and documented signs of kidney dysfunction, and they are almost universally blamed on something else: dry climate, aging skin, eczema, allergies. But here's what is actually happening. Healthy kidneys maintain a precise balance of minerals in the blood, particularly phosphorus and calcium. When kidney function declines, phosphorus begins to build up in the bloodstream because the kidneys can no longer excrete it efficiently. Elevated blood phosphorus draws calcium out of the bones and into the bloodstream. This mineral imbalance, specifically the calcium-phosphorus dysregulation, irritates nerve endings in the skin, causing a deep, persistent itch that does not respond well to standard moisturizers or antihistamines. It comes from inside the body, not the surface. The symptom is so specific to kidney disease that it even has a name: uremic pruritus, and it affects a significant proportion of patients with moderate to advanced chronic kidney disease. Additionally, when waste products accumulate in the blood, some of them are deposited under the skin. This can cause the skin to appear dull, slightly discolored, or what some patients describe as looking washed out. Research published in the Journal of the American Academy of Dermatology has noted a strong correlation between chronic, unexplained pruritus itching in older adults and underlying kidney disease that had not yet been formally diagnosed. If you are moisturizing regularly, using quality products, and still experiencing persistent, unexplained itching, particularly at night, please mention it to your doctor and specifically ask whether a kidney function panel has been done recently. It is not just a skin problem. It may be a kidney problem, wearing a skin problem's clothes. The next sign is one that affects nearly everyone over 50 at some point, and that is exactly why it is so easy to miss. The fifth warning sign is shortness of breath, and its more specific form: difficulty breathing when lying flat. Now, breathlessness is associated with the heart and the lungs. Virtually everyone knows that. And so when someone begins to feel unusually breathless with mild exertion, or notices they need an extra pillow at night to breathe comfortably, they think heart problem, lung problem, anxiety, deconditioning. They're almost never thinking two kidneys. But here is the connection that most people do not know. When the kidneys are not functioning properly, fluid can accumulate not just in the legs and ankles, but in the lungs. This is called pulmonary edema, and it is one of the more dangerous complications of advanced kidney dysfunction. Fluid in the lungs compresses the airspace and makes breathing physically more difficult, particularly when lying flat, because gravity no longer helps keep that fluid in the lower body. At the same time, the anemia caused by decreased erythropoietin production, which are described when talking about fatigue, means the blood is carrying less oxygen per unit. The heart and lungs have to work harder to compensate. This produces a feeling of breathlessness that goes beyond what you would expect from your fitness level or daily activity. This is where I want to be very direct with you. Shortness of breath when lying flat, called orthopnea, is a medical symptom that should be evaluated promptly. It can indicate heart failure, it can indicate lung disease, and it can indicate severe kidney dysfunction. None of those are conditions you should monitor from home without professional assessment. A study in the Clinical Journal of the American Society of Nephrology found that cardiorenal syndrome, the dangerous interplay between kidney failure and heart failure, is one of the most underdiagnosed conditions in adults over 60, precisely because the symptoms of each condition amplify and obscure the other. If you are waking up at night because you cannot breathe comfortably lying flat, please treat that as an urgent signal, not a reason to panic, but a reason to be seen soon. Let me bring these 5 signs together before I move into what I want you to actually do with this information. We have covered unexplained changes in urination, particularly foamy urine, and frequent nighttime waking, persistent swelling in the legs and ankles, especially in the morning, deep fatigue and cognitive fog that sleep does not resolve, dry, persistently itchy skin that does not respond to standard treatment, and shortness of breath, particularly when lying flat. None of these signs scream kidney failure on their own, and that is the entire point. They are quiet, they are individually explainable, they can persist for months or years before a person connects them to a single underlying cause, and by the time that connection is made, significant kidney function may already be lost. This is not meant to frighten you. This is meant to arm you. Now I want to shift from warning to action, because the goal of everything I have just told you is not to make you anxious. The goal is to make you informed, proactive, and prepared. Here is a practical protocol you can begin immediately. Step 1. Request a kidney function panel at your next doctor's visit. Ask specifically for a serum creatinine, an EGFR estimated glomerular filtration rate, and a urine albumin to creatinine ratio. These are standard, affordable tests. If you are over 50, have high blood pressure, have diabetes, or have a family history of kidney disease, this panel should be part of your annual checkup. If it is not, request it. You have every right to ask. Step 2. Track your symptoms deliberately for 2 weeks. Keep a simple note on your phone. Each morning, note whether you woke up to urinate, whether any swelling is present, how your energy feels on a scale of 1 to 10, and whether your skin is itchy. 2 weeks of consistent notes gives your doctor something meaningful to work with, far more useful than I've been a bit tired lately. Step 3. Audit your medication use. Non-steroidal anti-inflammatory drugs, NSAIDs, which include common over-the-counter medications like ibuprofen and naproxen, are among the most significant causes of preventable kidney damage. In adults over 50, they reduce blood flow to the kidneys and can accelerate decline in people who already have reduced function. If you are taking these regularly for pain management, please discuss alternatives with your doctor. There are safer options. Step 4. Control what is controllable. High blood pressure and uncontrolled blood sugar are the 2 leading causes of kidney disease worldwide. If you have either condition, kidney protection must be part of your management conversation. Medications in the ACE inhibitor and ARB class have been shown to be specifically protective of kidney tissue. The newer class of diabetes medications, called SGLT2 inhibitors, has also demonstrated significant kidney protective effects. In clinical trials, ask your doctor whether either of these is appropriate for you. Step 5. Hydrate, but do not overhydrate. Adequate water intake supports kidney filtration. The general recommendation for most adults is approximately 6 to 8 glasses of water per day. However, if you already have significantly reduced kidney function, excessive fluid intake can actually be harmful. This is a conversation to have with your specific doctor based on your individual numbers. These 5 steps do not require a specialist, they do not require expensive tests, and they do not require anything extraordinary. They require paying attention and then acting on what you find. I want to come back to Margaret for a moment. After her diagnosis, Margaret made the changes. She worked closely with her nephrologist, addressed her blood pressure, and eliminated the ibuprofen she had been taking weekly for knee pain. 2 years later, her kidney function had stabilized. It had not fully recovered, that kind of damage rarely does, but it had stopped declining. Her quality of life was good. She was still in her garden. She told me once, "I wish someone had just told me what to look for." That is why this video exists. So let me recap what we covered today. The first sign, changes in urination, particularly foamy urine, and frequent nighttime waking, which can indicate protein leaking through damaged kidney filters. The second sign, persistent swelling in the legs and ankles, especially in the morning, caused by sodium and fluid retention when kidney regulation fails. The third sign, the one that surprises people most, deep, persistent fatigue and brain fog caused by reduced erythropoietin production, resulting in anemia and by the accumulation of waste products in the blood. The fourth sign, persistent itchy, dry skin, often worse at night, caused by mineral imbalances, specifically phosphorus buildup that irritates nerve endings from the inside. And the fifth sign, shortness of breath, especially when lying flat, which can indicate fluid accumulation in the lungs or the compounding effects of kidney-related anemia on oxygen delivery. None of these signs alone is a diagnosis. All of them together, or even several of them appearing consistently, are a reason to seek evaluation. The kidneys are silent workers. They will compensate for a long time without complaining loudly, but they will give you signals. And now you know what those signals look like. Your health after 50 is not a passive experience. It is something you participate in actively. The information you now have is genuinely protective. Use it. Before you go, I have one question for you. Have you or someone you care about ever been told your fatigue or swelling was just aging, only to find out later there was something more going on? Share your experience in the comments. Those conversations matter, not just to me, but to the other people watching this video who may feel very alone in what they are going through. If this video gave you information you needed to hear, please pass it on to someone over 50 who might benefit from it. A parent, a sibling, a close friend. Sometimes the most important health conversation starts with a shared video. And if you want to continue learning how to protect your health after 50 with honest, science-backed information and no exaggeration, subscribe to this channel. There is a great deal more ahead.